Well, we know that Gauteng is in a crisis. The Premier saying our province is a dangerous place right now with COVID cases skyrocketing. The Provincial Command Council has been meeting today to discuss additional measures to clamp down on the spread of the virus. And I'm joined now by Dr. Mary Kawonga, a medical doctor and public health specialist. She also chairs the Gauteng Premier's Advisory Committee on COVID-19. Doctor, thank you so much for joining us. What are the options on the table for Gauteng? We know that the Premier wants more restrictions. What are the options?
Good evening, Sally, and good evening to your viewers, and thanks for having me on the show. Well, I think when we're in a situation like this, I guess the question is, do we go to a more restrictive lockdown level like alert level 4? Or do we stay on alert level 3 and just enforce the provisions in alert level 3 and use those? Or perhaps do we go with an option that allows us to have some targeted restrictions in one area, perhaps more than another? In other words, having a sort of a hybrid approach. And I think there are a number of possibilities that policymakers would consider. But they'll have to consider the key principles whenever we're adjusting public health and social measures. One is the health issues, and the other one is the economic considerations. And I think it's a tough balancing act for any policymaker. And our committee, what we do is provide the data on the state of the pandemic so that they can consider the health considerations. But then there are also obviously economic considerations as well.
Yeah, you're right. If it was just a health issue, we could just say to everyone, let's shut up shop, let's do a circuit breaker for 2 to 3 weeks, we'll look after everyone, stay at home, and it would absolutely break the chain of infections to some extent. I spoke to Professor Charles Parry a little earlier of the Medical Research Council. Of course, he does extensive research into the impact of drugs and alcohol. His view is that we've left it too late to do anything drastic, except perhaps ban alcohol for a period, because that research shows has a direct impact on hospital admissions. And that's the real worry, isn't it?
That is the real worry, you're correct. The hospital admissions and pressure on the healthcare system, particularly the hospitals. And I think the world over, that's often the key consideration for policymakers. Sort of having some measure of at what point do we say that our health system will not be able to cope and therefore we need to put in more restrictive measures. So protecting the hospitals is obviously the most important priority at this point. However, we are still recommending measures to continue preventing transmission, such as adhering to non-pharmaceutical interventions by both the public and establishment owners, workplaces, etc., etc. But the point about alcohol, I mean, though alcohol itself, as we all know, is not really to prevent transmission of the virus, but I think it does have some impact on behavior. And obviously it also has an impact on hospital beds. Look, it also has economic considerations. So it has to be a very tough balancing act again between what kind of and what level of alcohol restrictions do you put in place? Do you have an outright ban? Or do you just restrict sales? And I think the most important thing is to continue monitoring the current alert level 3 has restriction on sales and seeing whether that's having any impact. It's too soon right now because we've only had alert level 3 for about 6 days. But with time, okay, let me not say with time because everyone will say, but we don't have time. We should be able to see an impact of restricting alcohol sales, though.
I want to ask you about provincial restrictions as opposed to national restrictions. So Charles Parry was saying, well, you probably need to do a national alcohol ban, otherwise people will just bring the liquor over the provincial border. But when we look at things like leisure travel, for example, if we restricted leisure travel in and out of Gauteng, that would surely help prevent spreading this third wave to coastal provinces, for example. Is that something on the table? Has that been discussed?
Look, at this point, I'm wary of trying to reveal what was discussed in the meeting because I think that's up to the Provincial Coronavirus Command Council to reveal to the public exactly what was said and what decisions have been made. And I'm sure there'll be an announcement soon. But there are a number of issues that were put on the table. But one of the things we have noticed of late is that within the province there's been a lot of mobility. And I think putting in place measures to try and address mobility within the province or making mobility safer for people within the province is something that can be done within the province without having to go to the national level to request the National Coronavirus Command Council to put in more restrictive measures. The idea about interprovincial travel is obviously another consideration, because obviously if Gauteng is a hub and people are going to other provinces, seeding infections in other areas, I think that's probably something that would require intervention at a higher level, which is the National Coronavirus Command Council.
We know that some of the army medics are due to start working at the extra unit at Barra. I think it's from tomorrow, with the possibility that another group of 60 will come by the end of the week. Are you confident that is enough to support the hospitals and the people who are run ragged already, and we haven't even hit the peak, it seems? Do you think we're going to need more than this?
Look, at the moment, I think those are the numbers that have been brought in to address the most urgent need at the moment. There might be need for additional ones, but I think that will be assessed by the Department of Health based on how they've reallocated staff as well within the health system. But I feel that that's really a good measure, bringing in the military to boost the human resource capacity, because as you mentioned just now, our health workers have been working tirelessly since last year, March, looking after COVID-19 patients as well as non-COVID cases, and now having to also vaccinate. So there was a need to bring in additional personnel, and I think that was a low-hanging fruit for now. And as far as I'm aware, there are also moves to bring in additional temporary staff as well to support the third wave response at this point.
All right. Well, I want to thank you for your time this evening. Obviously, you can't tell us everything, but we do note that we will hear in the next couple of days what restrictions we might be in for, given the crisis in Gauteng. And thank you very much for your time. That was Dr. Mary Kawonga. She chairs